Good evening, viewer. Welcome to our FTV English version. Yes, most amazing news. Yeah, a new exploratory study has revealed statistical links between the performance of medical detection dogs and their scores on behavioral and affective tests, finding the more optimistic dogs tended to perform better overall on detection tasks, but pessimistic dogs had higher scent detections specificity. Saran Bistare Dabha of the University of Bristol, UK, and colleagues present their findings in the open access journal PLOS One. Animal researchers commonly use a method called judgment bias testing to help assess animals' emotional states. For example, dogs may first be trained to associate a specific location in a room with treats and a different location with no treats. When presented with intermediate locations where a treat may or may not be present, the dog's responses are assessed as a proxy for their emotional states. Yeah, dogs. Dogs who tend to run quickly to intermediate locations in hopes of a treat may be considered to have a more optimistic emotional state. However, prior research involving judgment bias testing has neglected medical detection dogs and dogs that can use scent to detect disease or assist people with chronic health conditions too, such as warning a diabetic patient or low blood sugar. Now, Bistere Dabha and colleagues have analyzed statistical associations between judgment bias scores, behavioral assessment scores, and scores on medical detection tasks for 27 medical detection dogs and 39 detection dogs in training. The analysis showed the more optimistic dogs, older dogs, and dogs who scored higher on tests assessing confidence, food orientation, and playfulness tended to score higher on detection tasks. However, among the fully trained medical detection dogs, those who were more pessimistic achieved a higher degree of specificity in scene detection tasks. BN's exclusive report, FTV English, Delhi, Bharat.